Hi, this is Dr. Ariel Waitsman from Dearborn Ear, Nose, and Throat and the Hearing Center of Excellence. Today, I want to talk about the link between hearing loss and dementia. If we go back perhaps 10 or more years, we really didn't appreciate that there was this strong a link. Most of us in the business used to think that people that had very severe hearing loss would be socially isolated. They wouldn't be in conversation, they wouldn't watch TV, and because of this, they had a high risk of dementia. But studies started to come out over the past 10 years. The most meaningful was probably by Johns Hopkins in 2011 that showed a significant link between the risk of developing dementia, even in patients that had mild and moderate hearing loss, not just severe hearing loss. This was a revelation in our business. We really didn't understand this. And we still don't know all the reasons behind it, but we do believe there is a direct neurological link between the ear and the brain. And as hearing drops and the hearing centers of the brain are affected, the cognitive and memory centers are likewise affected. After this, the National Institutes of Health gave funding and a grant to Johns Hopkins to do further research. Interestingly, one of their findings was if you intervene and correct hearing loss, then you can reduce the number of people developing dementia, perhaps up to 50%, which is very important because we have effective treatments for hearing loss, which is usually a hearing aid. Finally, there was an interesting publication in the Lancet. The Lancet is probably the biggest of the British medical journals and a very prestigious journal. And it identified hearing loss as the number one preventable cause of dementia. Sure, dementia can be genetic and from a multitude of other reasons, but most of these are not under our control. However, hearing loss is, because almost everybody with hearing loss can be improved either medically or with a hearing aid. So again, we find this to be extremely important because if we intervene early, we can prevent people from getting dementia. The dementia risk seems to escalate with how bad the hearing loss is and how long you have the hearing loss. So patients who are perhaps in their 50s and 60s who do have some hearing loss are going to be at very high risk when they get into their 70s or 80s. And intervening at an early age seems to be very important in reducing the chance of these patients developing dementia and having a much better quality of life as they age. Thank you for listening. Please subscribe to our YouTube channel. And for any further information, certainly you can call our office or go to our website.